Hi, everyone. Thank you so much for joining us today. Again, welcome to Migratory and Seasonal Agricultural Worker Identification, Registration, and Reporting in the UDS. Again, my name is Katie Kahneman. I'm the Increased Access to Care Project Coordinator, and joining me today is Lisa Miller, the Training Services Manager. There are three main learning objectives today. By the end of this session, you'll be able to describe the relationship between classification, uniform data system, UDS reports, and health center funding. You'll be able to identify industries and tasks in agriculture that meet the definition of agriculture and should be considered when classifying an agricultural worker for UDS reporting. And you'll be able to distinguish between the different classification types for agricultural workers and utilize that acquired knowledge to correctly report agricultural patients in UDS. For those of you who may not be familiar with NCFH, we are a private nonprofit organization located outside of Austin in Buda, Texas. Our mission is to improve the health of farm worker families, and we do that by providing programs, trainings, technical assistance, and resources. We have provided these services for over 45 years, and we're very proud to be able to serve the 174 health centers in our network who provide primary care services to agricultural worker families. One of the ways that we address our mission and keep access to care at the forefront of our work is through the Ag Worker Access Campaign. The Ag Worker Access Campaign was launched in 2015 as a joint effort between NCFH and the National Association of Community Health Centers, NAC. We, along with health center staff and other ag worker advocates, knew that there was more that could be done to increase access to quality healthcare for America's ag workers and their families. The result was the Ag Worker Access 2020 campaign, which has since been renamed the Ag Worker Access Campaign. We have seen steady increases in the number of ag workers served in health centers since the campaign's launch, up until 2020 due to the impacts of COVID-19, when we saw a decrease in the number of ag workers served. We are confident that we can get back on track and reach our goal of serving 2 million ag workers in health centers, but we need your help. We encourage you to visit the Ag Worker Access Campaign webpage. A link will be dropped in the chat to learn more about the campaign and to join health center colleagues around the country and other ag worker advocates in supporting this special population by becoming a part of this initiative. And now I will pass it off to Lisa.
Thanks, Katie. Okay, so let's talk about identification and registration of our special populations. There are several reasons why it's really important to identify a patient as a member of a special population. The federal government has identified groups of community members that have limited access to healthcare services and have really unique challenges in accessing services. So therefore, the government provides funding to support provision of healthcare to specifically target these special populations. And as you can see here on the screen, the patients that belong to these special population groups include those experiencing homelessness, migratory and seasonal agricultural workers, veterans, patients served by school-based health centers, and patients served at a health center located in or immediately accessible to a public housing site. We need to keep in mind that it's important to identify all of our special populations, and that's regardless of whether or not you receive that special population funding. Okay, so we definitely need to identify all those special populations. Next slide, please. And we report those special populations in the UDS. UDS stands for the Uniform Data System, which is a government-required electronic reporting mechanism for health centers that receive funding under Public Health Service Act 330. So this includes community health centers, migrant health centers, healthcare for the homeless, and residents of public housing as well. And the things that we're reporting in the UDS are listed here on the screen. You'll see number of patients served, our patients' population demographics, which include race, ethnicity, age, income levels. We also report services provided, clinical processes and results, the types of staff employed at the health center, as well as the types of funding and payments that are received by a health center. And why do we do this? As we mentioned, if you're receiving any type of 330 funds under PHS 330, then one of your, when you receive your grant funding, one of the requirements is this reporting. So we definitely do that for that reason. But we also want to be accountable for the funds we're receiving and show a return on investment. So show the federal government that we're being good stewards of the funds. Okay. And then of course it is vital to these UDS reports are vital to understanding a health center's impact in expanding access, improving quality, and reducing the cost of healthcare. So these reports are really important. Next slide, please. And so when health centers apply for funding, they mention in their grant applications the number of migratory and seasonal agricultural workers that they're planning to serve. So if they receive the grant funding, then we go into this second rectangle here. There are certain obligations that come along with that funding. That includes being in compliance with HRSA program requirements, of course, providing the service to the population that you said you would be serving. And then, of course, submission of UDS reports. And if we do all those three things, then the likelihood of continuation of funding is really good. So that's the third rectangle there. And then, of course, there are also opportunities to apply for migrant health funding if you aren't currently receiving those funds. Next slide, please. And can we forward to the next slide, please? Okay, and so in our UDS reports, who's reporting and what are they reporting? Okay, so if you receive 330G funding, so migrant health funding, then you're required to report in your UDS the number of migratory agricultural workers, number of seasonal agricultural workers, and also the total number of migratory plus seasonal. So that's listed here in your UDS. It corresponds to lines 14, 15, and 16. However, if you're not receiving migrant funds, you are still required to report line 16. So your total number of agricultural workers, migratory and seasonal combined. And in order to get to that number, you do need to know how to identify migratory and seasonal. So that's why it's important for you to be able to go through that process. Next slide, please. So it's really important to note the difference between verification and classification, which is what we're talking about today for UDS reporting, versus eligibility. We do receive that question quite often. Is this particular person eligible to be seen in our health center? So we want to make sure that we're really clear on that distinction. What we're doing here is verifying special population status. That's why we're identifying migratory and seasonal agricultural workers and their families. We want to verify that they're part of the special population so we can report them in UDS, which, as I mentioned, is part of what's required under our grant. Okay, but that's very different than eligibility. As we all know, anyone in the community can be seen in a health center. The eligibility comes in for any special programs you may have, such as sliding fee scale. There's an eligibility requirement for that. A certain income level. So for that would be an eligibility situation. But for what we're talking about today, classifying, identifying, and reporting your ag worker population, that is all about verification, and it's very different. Okay, so the classification of the patient does not impact their eligibility to receive services at a health center at all. Next slide, please. And so in order to verify migratory and seasonal ag worker status, we need to know three main things. The first is the definition of agriculture. and that's HRSA's definition of agriculture. So that might be slightly different than, for example, if you've worked with Migrant Head Start or your state monitor advocate, the Department of Labor, they may have a slightly different definition of agriculture. But again, for reporting in UDS for Section 330 grantees, we're going to be using HRSA's rules on HRSA's definition of agriculture in our discussion today. So we need to know the definition of agriculture, the types of industries and tasks in agriculture that are included and also excluded under HRSA's rules. And then we're also going to go through the classification of agricultural workers. What are those classifications? So if we go through those 3 items, we should be pretty confident and that we are classifying and reporting our migratory and seasonal ag workers correctly in the UDS. Next slide, please. So now we're going to break them down. But first, let's look at the definition of agriculture as defined in the legislation. And agriculture means farming in all of its branches. That includes crop production, animal production, aquaculture, and then support activities that are associated with those 3. And again, this is specific to migrant health. But basically it involves everything from prepping the soil, seeding, planting, growing. Think about that cultivation process. That's what we're going to be talking about in this definition of agriculture. Next slide, please. And we'll start with the tasks and industries, again, under HRSA's definition. And NAICS codes that we have listed here, NAICS stands for the North American Industry Classification System. And these are the codes that were used to develop the definition of agriculture. And they include 2 main codes and 2 subcodes that are included in HRSA's definition of agriculture. That includes 111, crop production, 112, animal production and aquaculture, 1151, which is the support activities for crop production, and 1152, which includes the support activities for animal production. And next slide. So first we'll go through 111, that's crop production. And this includes things like grains and nuts, fruits and vegetables, nurseries, and other commodities that you may have in your service area, such as cotton, tobacco, hops, even Christmas trees would be included under this code. Next slide, please. And then the support activities that are associated with crop production include harvesting, soil preparation and cultivation, all those things you think about with farm labor. It also includes some of the post-harvest things like sorting, packing, and processing if they're done on the farm. So if it's an outside company that's doing all of that, it's off the farm, then that would not be included. The same thing with transportation. If the trucks that are transporting the produce or the commodity to market or wherever it's going, if they're associated with the farm, they would be included in this 1151 code. However, if it's an independent contractor, a trucking company that's coming in and transporting the items, then they would be a different NAICS code. So if we looked it up in the NAICS search, we would find that under a specific trucking transportation code. So it'd be a little different. Next slide. And then 112 is animal production. So that includes what we normally think about, like cattle, chickens, those sorts of farms, dairy farms, hatcheries. Those are all included in 112 animal production. We also include here fisheries, so aquaculture. And the thing to keep in mind here is, again, we talk about the cultivation process. Fish, and if you have a fish farm, you're cultivating the fish. You're feeding them, you're cultivating them. That's different than, let's say, deep sea fishing. Some of you may live in an area where deep sea fishing is available, and for that would be a different NAICS code, because if you think about it, you're just going out and gathering what's already been cultivated. Okay, so that's a little different than aquaculture. So deep sea fishing would not be included, but fish farms, aquaculture would be included in this code. 112. We also have some additional animal production that you might not usually think of, a little bit, we normally think of cattle and chickens and things like that. But some other things that are also included in this code that are pretty interesting that you might not have thought about that might be in your area that you could include in your UDS are those that work with horses, donkeys, and llamas, bees, crickets, and worms. Fur-bearing animals are also included in this section, as well as lab animals and even companion animals. So dogs, cats, and birds, if they're companion animals, would be included in this 112 code. Because again, raising and growing animals is a commodity. You're raising that commodity. Okay. And the next slide, please. And then support activities associated with this include branding, boarding, reproductive services, livestock spraying and cleaning, that sort of thing that are associated with that animal production process. And we do have a link here for the NAICS code search, and you can search by keyword. So if you're ever in doubt, you can look there and type in, bees, and it'll come up with everything with that keyword. And if you see anything with these codes, as I said, if they start with 111, 112, 1151 or 1152, then they would be included in this definition. And usually it's a few more digits past that, but the first digits will be these codes. And then that's in the chat for you now. Okay. And then in addition to being familiar with the industries that ag workers work in, it's also really important to be aware of the tasks that they're doing, because oftentimes your patients will identify by the things that they're working on. So they may say, I'm a detasseler. If you think about it, we're here learning how to identify and report migratory and seasonal agricultural workers. So we can't expect them to automatically identify migratory and seasonal under our definition. Okay, so being familiar with these tasks is really important. Here, then just a few of them here: sorting, preparing, canning. Again, all those things associated with those commodities. And a great idea to have on hand at your front desk is a list of those tasks, or to do it as part of a team exercise in one of your team meetings, is identify what those tasks are that are being done in your area and create a little cheat sheet for your front desk and for training purposes. So everyone's familiar with what's going on in your area, and they can better identify those ag workers in your area. And we will share a link at the end of the session for a template that we've created that has images for each of those codes, each of those NAICS codes that we mentioned, that you can insert. We have some sample pictures there, but you can insert your pictures and replace them with things that are common in your area. And that helps you get the conversation started with your ag worker patients on those tasks. And also it's a great training tool. Next slide, please. And then we also need to know about the excluded tasks, because sometimes the line seems a little fuzzy. So we need to make sure we're really clear on the things that are not included, so we don't accidentally report someone that in our UDS that shouldn't be there. Okay, so the first industry that's one of the excluded tasks is the 42447, meat and meat product merchant wholesalers. So as I mentioned, all the way up to the trucking, raising the animals, even the transportation, if it's associated with the farm, all that's included in the definition. But once you get to the slaughterhouse, those merchant wholesalers, that would not be included. That would be a different NAICS code. So as you can see here, it starts with a 42447. So that's different than the ones we mentioned earlier. So we wouldn't include those workers. And then the second one is landscaping services, which is 561730. And I mentioned earlier that nursery workers were included in the definition, but landscaping services are not. And again, if you think about nursery workers, they are again cultivating the plants, the trees, all the things that possibly the landscapers will use, but usually the landscapers are not the ones doing all the cultivating. They're actually the ones that are they're purchasing maybe from a nursery, but they may be watering the plants or something just to maintain them while they're getting them to where they need to go. But it's a different process. So that would be a different NAICS code. Also spectator sporting. I mentioned horse farms earlier. So if someone is working on the horse farm, raising those horses, they would be included. But those folks that are working in the backstretch, for example, you know, your backstretchers that are taking care of the horses there on the racetrack would not be included. However, it's important to get more information from your patients, because you might find out that they are working on the backstretch just during the race, but their principal employment is on the farm taking care of the horses there. So then we would be able to include them. So having those conversations with your patients is really important. And then the last one is trekking and timber. That's 48422. And I mentioned Christmas tree farming. Again, you're cultivating, so that one would be included. But if you're just going and processing the trees, you know, that's a different NAICS code. So that would be one of the excluded industries. So we wouldn't include those workers. And the next slide, please. Now we'll go through the verification process. Okay, and we have 6 main steps that we'll go through. And so you'll see this little chart a couple more times in our presentation. If we go through these 6 steps, again, we feel pretty confident that you'll be able to properly identify and report your ag worker population in UDS. So the first step is we want to establish their occupation. We want to make sure that their principal employment is in agriculture. Step 2, we want to determine the time frame. So, and the magic number there we're going to look at is 24 months or 2 years. And the third step is to determine migratory status. So, and then the fourth, seasonal status. So if they're not a migratory worker, then are they a seasonal worker? Step 5, we want to identify former migratory workers. So those are the aged and disabled ag workers. And then step 6, we want to make sure we identify all family members. And so I'll go into those steps a little more in depth now. Next slide, please. The first step is to establish the occupation. We want to find out if their principal employment is in agriculture. And each of these slides, for these steps, we have a verification question. And these are questions that we recommend you include in your registration forms so that you can, you know, we're making sure, again, we don't want to just have a form where we're saying, are you a migratory or seasonal agricultural worker? If we ask these questions, we'll make sure we capture all those different groups that can be classified. Okay, so the verifying question here is, have you or anyone in your family worked in agriculture? And that's where it stops. And we'll go on to the next step and get more information. So as we go through all the steps, we'll gather more and more information to be able to make a decision for, you know, to ensure that we're accurately reporting. The next slide, please. The next one is to determine the time frame. And the verification question there is, have you or anyone in your family worked in agriculture in the last 2 years or 24 months? And again, this doesn't have to be, they don't have to have worked in agriculture for a certain amount of time in the last 2 years. It's not, you have to have, you know, have worked those 24 months consecutively or anything like that. At any time in the last 2 years, have they worked in agriculture as their principal employment? And if the answer to that is yes, then we would go on to the next step. And that would be to determine migratory status. The verification question here is, have you or anyone in your family established a temporary home in order to work in agriculture? If they did, then that would be a migratory worker. So, and again, it's not the distance that they're traveling. It's actually that they have to establish a temporary home. So they can be going from state to state, which we often think of for our migratory workers, but sometimes they're working in the same state. For example, we live in Texas. If somebody in South Texas If their home base was in South Texas and they were coming even to Central Texas, that'd be a 5-6 hour drive. They couldn't go back at the end of the day to do that. So they would have to establish a temporary home. And the temporary home can be anything. It can be housing provided by an employer, living with a friend or relative, renting a property to live, living in their vehicle, sometimes a makeshift home near the field, whatever that temporary home is. If they establish a temporary home to work in agriculture, then we would say they are a migratory agricultural worker for UDS purposes. Now, if they do not, then we would go on to the next step and find out if they are a seasonal worker. And the question here we would ask on our registration forms is, have you or anyone in your family worked in agriculture on a seasonal basis without having to establish a temporary home? And so seasonality is not defined in legislation. And so that's up to your health center if you have a specific criteria on it. But the main thing to consider here as you're making those decisions is to think about the nature of the work for an ag worker, or for a seasonal ag worker. They may have lots of fluctuations in their hours, the type of tasks they're doing, their income may change based on the season. So that kind of instability is really what we're looking at with determining their seasonality. And there's a little statement here with an asterisk that is pulled from the UDS guidance that says seasonal agricultural workers may be employed throughout the year for each crop season, and as a result, may work full-time. So seasonality doesn't just mean they work part-time and then they are going to another job, which we often think of as a seasonal worker. Maybe they work in the fields a certain time of year, and then they work in another type of job for construction or something else. Maybe they do work at a landscaping company, something like that. But they can also be employed throughout the year, depending on the crop season, they'll still have that fluctuation. So those are some things to keep in mind as we're thinking about our seasonal agricultural workers. And next slide. And the Consolidation Act of 1996 expanded the definition of agriculture to include aged and disabled agricultural workers and family members. So for step 5, we want to make sure we're asking questions that include those aged and disabled former migratory agricultural workers. So the verification question there is, have you or anyone in your family stopped migrating to work in agriculture because of a disability or age? So again, this is for former migratory workers only. If they're seasonal workers that are no longer able to work just in general due to disability or age, they wouldn't be included in this group. But it's always important to ask those questions, to ask the question of, have they stopped migrating to work because of age or disability, because of disability or age? Because it may turn out that at some point in their career, they were a migratory worker, but they had to stop migrating for that reason. And that may be, so they may have been a seasonal and migratory worker at some point in their career, but they stopped migrating due to age or disability. So it's important to have those conversations. And so we would include them in UDS, we would classify them as a migratory worker. So there's no separate classification in your reporting. As I mentioned, you have those lines 15, 16, and 17. You would report them in line 15 as a migratory worker. Okay. Next slide, please. And then we also want to identify all family members. As I mentioned, the Consolidation Act expanded the definition to include family members as well. So anyone that we're classifying in our UDS as migratory and seasonal, and those aged and disabled workers that we're also classifying as migratory, we want to include all of their family members also, and they would be classified the same as the family member. Okay. And so this is language from the UDS manual. And it mentions family members who are within a designated catchment area. That catchment area is determined by your health center. So those are conversations to have within your health center. Make sure that you have policies and procedures in place, And so that everyone's on board, even with all these different steps that we're talking about here. So everyone is identifying, classifying, and reporting the same way. And you're all gathering the same information in the same way in an accurate way. Okay. So we want to make sure we're classifying all those family members. And go on to the next slide. And these are the classifications. So we have the three I mentioned, migratory ag workers. Those are ag workers. Again, their principal employment is in agriculture. They've worked in agriculture at some point in the last 24 months, and they have had to establish a temporary home to work in agriculture. Okay, those are our migratory agricultural patients. You would report them in line 15 of your UDS. And then the note on the bottom says we're going to include all family members. They're going to count the same as the ag worker family member. So any migratory agricultural workers and their families would be classified in that line number, okay, as migratory. And then seasonal agricultural workers are those whose principal employment is in agriculture on a seasonal basis. Again, they have that fluctuation I mentioned, that instability. And they've been employed as well within the last 24 months in agriculture on a seasonal basis. But they did not have to establish a temporary home. So we would include them and their family members as seasonal agricultural workers in UDS. And then the last category, aged and disabled, again, they're former migratory agricultural workers who are no longer able to work in agriculture. They're no longer able to migrate due to age or disability. So they would be classified as migratory agricultural workers in our UDS. And that's the one category where we don't ask about the 24 months. So the first two, they do need to have been in agriculture in the last 24 months, but the aged and disabled, there's no time frame that we look at for that group. But we would include their family members. We would also classify them as migratory in UDS. Okay.
Lisa, can I bring a question up from the chat real quick?
Sure.
We got a question that I wasn't sure the answer to. Do we know why seasonal workers are not included in the age and disability category?
I really don't know why, but when they did expand the definition, it was specific that it was the migratory agricultural workers. So that's the way it's written in the Consolidation Act.
Thank you.
But that's something we can go back and research and see if there was any reasoning maybe that was included in that, and we can definitely look into that. It's a great question. Okay, so I know we went through that pretty quickly, but we did want to have enough time for you all to run through some case studies and scenarios to practice what we've just talked about. So you will have access to these slides, and then we'll have some Q&A after this session. But we do have a couple of tips I was going to drop in real quick, if we can go back to those tips and strategies. Okay. And again, you'll have a copy of these so you can go back and refer to them. But it's really important to implement policies, procedures, and make sure your staff are all trained to ensure that everyone understands your special populations. And of course, here we're talking about migratory and seasonal ag workers, and how to accurately identify and register them in your UDS. Okay, we want to make sure everybody's on the same page on our reporting. We also want to make sure we're asking the right questions on the registration forms. So as I mentioned, we included questions for you in each of these steps to make sure that we don't miss anyone. We want to make sure we're asking the right questions as we go along. We also want to remember that 24-month time period at any time, because they may come in today and they're working a different job. And, let's say you have somebody coming in with a workers' comp case, and they're, again, we'll use construction as an example, and you may not think of asking them about their ag worker status. But if we make it a practice to ask everyone at every visit, then we'll make sure we capture that information. We want to make sure we ask within the last 2 years. Okay. And then we want to make sure that all patients or guardians are screened for ag worker status and other special populations, regardless of their insurance or employment. So even if you have a young child that comes in for a physical that has Medicaid, again, we want to make sure we're asking every person that comes in, so we don't overlook someone that should be included in this designation for reporting purposes. Next slide, please. And again, verification, we should be asking at every visit. We want to have those additional tools available at the front desk that I mentioned. So a list of employers, so that makes it easier. Again, if they identify, if they say I work for this particular company and you know that that's a company that employs agricultural workers, you can make sure you have that conversation and go through those questions and verify if they are a migratory or seasonal agricultural worker. Same thing with a cheat sheet of common tasks. As I mentioned, and being familiar with what those tasks are in your area that are common, and letting your staff know, using that as a training tool and making it available for your ag workers as well. The visual to be able to identify is a great idea. And then, of course, cross-referencing adult workers with family members. We have had health centers that cross-reference their records and find that they have not have missed some family members that could be included in their reporting as well. And then, of course, we always want to develop outreach strategies to inform the ag community of your services, and that you are there to be their health home when they're here. And so it's a great a great practice to do that, work on your outreach strategies. And then now we'll transition over to Katie so we can work on some of these case studies and practice what we've discussed.
Awesome. Thank you, Lisa. So as Lisa mentioned, we're going to take all of that great information and our verification steps and process and practice them with some case study patient scenarios. So we're going to be using Zoom polls to make this interactive. So they will pop up on your screen as we go through each case study, and we'll work through the questions, and I'll have you respond within the Zoom poll as we go. So just as a reminder of these 6 steps, for each scenario, we're going to work through all of the verification questions to accurately identify and classify the patient, how we would report them in the UDS. So we're going to first start with establishing the occupation. So we're going to look at our description of the patient and ask ourselves, is agriculture the principal employment according to HRSA's definition? Has this patient or anyone in the patient's family worked in agriculture? Then we're going to determine that time frame. Have you or anyone in your family worked in agriculture anytime in the last 2 years or 24 months? And we had a great question in the chat about that time frame. It can be any time in the past 2 years or 24 months. There's no requirement on the length or duration of work in agriculture. It could be 2 weeks or 2 months, any time in the past 2 years. Then we will want to determine migratory or seasonal status. So as Lisa explained, for migratory status, if that patient is establishing a temporary home in order to work in agriculture, they would be classified as migratory. If they're seasonal, they would work on a seasonal basis without having to establish a temporary home. So those are the patients that work in agriculture where their jobs, hours, tasks, or incomes change with the seasons. Then we'll want to capture and identify our former migratory agricultural workers, those who have stopped working due to age or disability, stopped migrating, and then making sure we're identifying all family members. So that's just a quick recap of our steps. So here's our first case study. I'll have Sylvia release the poll while I read the description here. So a poll should pop up on your screen. Our patient is Valeria. She's 44 years old. She works for a large dairy farmer as an administrative assistant, organizing phone calls, emails, paperwork for product pickup and delivery. So if we're starting with step 1, establishing her occupation. So the first question on your poll, is agriculture Valeria's principal employment? So if we're looking at her industry and her tasks in this description, can we say yes or can we say no? So I'll have you all respond to the poll, answer that first question. And then in this scenario, when we're looking at her industry, the dairy industry, that seems to check the box initially, and as we work through the rest of the description, maybe her tasks don't quite align with our definition of agriculture. So once you finish completing those first two questions, go ahead and submit your poll. And we'll discuss the answers. I'll give just another minute here. So how would you classify this patient? Okay, I'll have Sylvia close the poll. Thank you. Okay, so you should be able to see results on your screen, but for the first question, we had about 38% of you respond yes, agriculture is her principal employment, and 62% responded no. And so the answer to that question is no. We cannot, based on what we know about Valeria's employment, her tasks do not fall within the definition of agriculture. So although she is working on a dairy farm, she is performing tasks that don't align with the definition of agriculture. So when we look to classify, we cannot classify Valeria as an agricultural worker. So it looks like 62% said we cannot classify her as an agricultural worker. 23% said she was seasonal, 50% said or 15% said she was migratory. So that was a little bit of a tricky one to start. And in a more organic patient scenario, you would have the opportunity to dig a little deeper, ask more questions to help clarify that for you. But based on the information we had, those tasks that she performs don't fall within the definition of agriculture. But because that was, not an expansive interaction with the patient Valeria, we do want to make sure with all of our patients that we ask all of the questions. So we couldn't move past step one because her occupation didn't fall within the definition of agriculture. But in a more organic scenario, we might ask the second question and find out that at some point she was working on the dairy farm in doing tasks that fall within the definition of agriculture, helping maintain the cows or something like that. And then if it was within the last 2 years, we could then classify Valeria as an agricultural worker after we move through the rest of the steps. So it is important to work through all the steps, but for this scenario, based on the information that we have, we cannot classify her. So I do want to allow for some questions on this one in the chat, if anybody has any, before we move to our next case study. I'm not seeing any quite yet. Okay, I don't see any questions. If you have them, put them in the chat and I will definitely address them. Okay. We'll move on to the second case study. So another poll will pop up on your screen. Our patient is Mr. Escobedo. He's 52 years old. He received a contract to work and arrived in South Carolina from Mexico last year. He lived in employer-provided housing with other workers where they harvested melons for about 8 months. And then he returned to his home base in Mexico. A month ago, he came back to South Carolina with a new contract to work at the same farm. He is at your health center because he is out of his blood pressure medication. So starting with our first step, is agriculture Mr. Escobedo's principal employment? So if we're looking, we don't know a lot about his tasks, but we can see that he was hired to harvest melons. So does that fall within the definition of agriculture? Yes or no? From there, we move on to determining time frame. So based on the information we have, has this patient worked in agriculture in any time in the last 2 years? So it sounds like there's been some fluctuation, but he did work in South Carolina at the melon farm for 8 months, left, and then returned about a month ago. So it sounds like in the last 2 years, he has been working in agriculture. So then when we move on to determine migratory and seasonal status, has this patient established a temporary home in order to work in agriculture? So we'll look for details in this description about his housing. And then ruling out seasonal status. Has this patient worked in agriculture on a seasonal basis without having to establish a temporary home? We can rule out this question as a no because we see that his home base is in Mexico, so he's not returning from South Carolina to Mexico at the end of the day. He has to establish a temporary home. So identifying former migratory agricultural workers. Again, we don't have information on this in the description, so we can't respond to this question in much detail other than no, because we don't have that information. And the same with identifying all family members. If we were in a real life patient scenario, we would ask all these questions to make sure, but based on the information we have. So we've gone through our 6 questions. I'll pause for just another second for everyone to fill out their polls. Okay, and I'll have Sylvia close them. Thank you. Okay, so is agriculture Mr. Escobedo's principal employment? 100% of you said yes, that is correct. Has Mr. Escobedo or anyone in his family worked in agriculture anytime in the last 2 years? 94% of you said yes, and 6% said no. So the answer is yes. Although there was a break in between his 8 months in South Carolina on the melon farm and then returning a month ago, that does fall within the past 2 years based on the information we have. So that would be yes. Has Mr. Escobedo established a temporary home in order to work in agriculture? This is also yes. We see that he lived in employer-provided housing. So then our answer to has Mr. Escobedo worked in agriculture on a seasonal basis would be no, because he was not able to work in agriculture without establishing a temporary home. And then, as we said for question 5 and 6, we don't have any information about him or anyone in his family stopping migrating for age or disability, so we would answer no to that question. The majority of you did say no. And then we also don't know about his family. So how would this patient be classified and reported in UDS? 75% of you said migratory agricultural worker and 25% said seasonal. No one said not an agricultural worker, so that's great. And based on the information that we have, this patient would be classified as a migratory agricultural worker. I also wanted to note here that based on the information we have, it also sounds like he checks a lot of the boxes to be considered an H-2A worker. I know there's been an increase in the number of H-2A workers across the country. So it's important for us to be aware of what the H-2A visa program is. And so it's likely based on what we heard in that description that he might be an H-2A worker. So he's received a contract to come to the United States from Mexico to work in agriculture, which is what the H-2A visa program does. We also know that there are H-2B workers out there, and there can be some confusion between H-2A workers and H-2B workers. We are excited to share a resource that will help clarify that for you all. That will be coming soon, so be on the lookout in our digest and social media and on our website. So I wanted to pause to see if there were any questions about this case study in the chat. Okay, so question 4 created some confusion. So let's look at that real quick. So have you or anyone in your family worked in agriculture on a seasonal basis without having to establish a temporary home? So is it the second part of the question, Alicia, that might be a little confusing? Again, the seasonal status isn't well defined in the legislation. So we just kind of have to consider whether the job, hours, tasks, or income change with the seasons. So if an agricultural worker is working in one particular crop for part of the year and moving to another crop, and then maybe there's an off season where they work in construction or another industry, that would be a seasonal status, seasonal agricultural worker status. Okay, any other questions? So we are running a little short on time. We do have a third case study that will be included in the PowerPoint slides that you will receive after this session. So you'll get the questions and the scenario, and you'll be able to work through it on your own or with your team members, and the answers will be there for you. But I did want to make sure that we had time to share about some resources and tools that are available to you. So Lisa will be dropping links to these tools and resources in the chat, but I wanted to share a few of them with you right now. We do have our archived webinars on the website. And this webinar, as well as this webinar in Spanish, which will be happening next week, will all be recorded and uploaded to our website and archived. We also have other webinars archived there for you to consider. We also have an ag worker identification digital training tool. So it is a lot of this content, the verification and classification steps and questions condensed into a 10-minute training video, is a great introduction to the ag worker identification process for new staff. It's also a great refresher for your more seasoned staff. So that's a great tool to check out. We also have our IAC Q&A packet. This is where we compiled frequently asked questions and answers gathered from webinars like this one, other IAC workshops and trainings, and provided responses and answers to those to help clarify them and provide additional tools and resources. And Lisa also mentioned this earlier in the session. We have an ag worker identification front office reference sheet. This is a cheat sheet type of tool designed to help health center staff ask the right questions for accurate identification and classification. And also it is customizable to include the crops, industries, tasks that are local to your area. We've seen health centers use this in interactions with patients, as well as just something to have on hand to help with the ag worker identification process. So all of those links have been shared in the chat. I also wanted to highlight one of our new resources, the Increased Access to Care Program Pillar Infographic. This tool is a great summation of the IAC program. It includes links to a lot of our tools and resources organized by what we think are the 3 essential program pillars for reaching your increased access goals, which are your health center's program policies and procedures, workforce development and training, and program outreach. So this is a great graphic visual, as well as summary of tools and resources to support implementing those 3 pillars in your program to reach your increased access goals. We also wanted to share about our IAC network. Our Increased Access to Care program and associated training opportunities were launched in collaboration with the Ag Worker Access Campaign, which we spoke about a little bit at the beginning, to assist health center staff in accurate identification and reporting of their ag worker patients. So since then, this program has grown to include a national virtual network of health centers, all with the mutual goal of increasing access to care for ag workers and their families. So through the IAC network, we have 2 learning collaboratives, the Increased Access to Care Core Learning Collaborative. This focuses on those 3 core IAC pillars that were in the resource that I shared on the previous slide: the staff development and training, program policies and procedures, and program outreach. So in this learning collaborative, we dive into those 3 pillars. We share ag worker identification training like today, and we develop migrant health action plans to work towards our increased access goals. And our second learning collaborative is kind of an after the IAC Core Learning Collaborative, and this focuses on social determinants of health, creating action plans and sharing tools for STOH screening. There's peer-to-peer sharing and working on identifying and providing solutions to overcome STOH barriers. These 2 learning collaboratives will be recruiting in the fall for the next learning collaborative, so be on the lookout for those opportunities. I also wanted to share that our Promising Practices Award for 2022 was announced. We're pleased to recognize Golden Valley Health Centers as this year's IAC Promising Practices Award recipient for their promising practices in providing education and outreach to their ag worker population, as well as other marginalized communities throughout COVID-19. You can read more about their promising practice and the Promising Practice Award on our website. A link will be coming in the chat. The funding for our Promising Practice Award and our Migrant Health Scholarships comes from our commemorative artwork sales. Each year we commission an artist to create an original image for this commemorative artwork series. The 2022 artwork is actually my Zoom background right now. So there'll be a link in the chat to learn more about our commemorative artwork and read up on this year's art piece and the artist. We also want you to visit our website. We have a ton of great resources on there to learn more about your ag worker population through our population estimation data, our ag worker fact sheets. We have other learning collaboratives as well to look into, lots of health education and patient education resources, as well as governance and workforce trainings. And then to highlight a few of the great resources on our website, also, we have an entire page dedicated to COVID-19 with up-to-date COVID information and resources for not just health centers, but resources that you can directly share with ag workers, translated into multiple languages, and always including the most up-to-date information. We also have our Call for Health program, which is a helpline that is available Monday through Friday for ag workers that are looking for assistance in finding a local health center or medical assistance. So we have the phone number for the call line, as well as the WhatsApp number on the screen. And then our regional stream forums. We just had all 3 stream forums. Hopefully some of you were able to join them, the West Coast, East Coast, and the Midwest. We'll share the link to those on our website as well. And we do want to acknowledge that NCFH is part of the Farmworker Health Network. We work cooperatively with HRSA to provide training and technical assistance to over 1,000 health centers throughout the US. And these are our national training and technical assistance partners on the screen that all offer training and resources to health centers serving the ag worker population. And here is Lisa and I's contact information. This concludes this part of the webinar. So if you're joining us live, if you have a few extra minutes, please stay on for some question and answer and to complete our webinar evaluation.